Viscosity of the blood will increase what? Increase viscosity. Anybody answered capillary venous pressure? I know earlier question was depressing, so we wanted some creativity in the next question. But examiner doesn't want much creativity. Straight answers, straight questions. If you look at the mean arterial pressure, it is decided by peripheral resistance, elasticity, blood volume, cardiac output. Peripheral resistance in turn is decided by blood viscosity and the blood vessel diameter is what we have to basically appreciate, doctor. So what is the main function of basal ganglia or cerebellum for that matter? Planning the voluntary motor activity. That's the reason we get tremor when basal ganglia get affected. How does nitric oxide basically function? It will activate guanylate cyclase, produce more cyclic GMP, which is the underlying mechanism of the vasodilation. Now patient is fearful on seeing people or objects not seen by others. He is typically without stimulus, he is having it, hence it is hallucination. Many times we discuss hallucination, delusion and illusion. Whether stimulus is there or not, whether it is misinterpreted, all these are basically differences, no? So hallucination. What are Schneider's second rank, first rank symptoms? Always one question on schizophrenia: audible thoughts, voices commenting, somatic passivity, thought broadcasting, delusional perceptions, they are all first rank. Whereas depressive and euphoric mood changes, perplexity and feeling of emotional impoverishment, they are all the second rank symptoms of the Schneider. So easy to remember, first rank symptoms is A, B, C, D. A for auditory hallucination, B for broadcasting of thought, and C for controlled thought, and D for delusional perception. A, B, C, D first rank Schneider's symptoms. Gadolinium. We were expecting which question in gadolinium? Nephrogenic fibrosis is there, no? That we are expecting, but examiner thought if you know gadolinium enough. Piezoelectric effect. Right from 8th class physics we had been answering this question. What does human body have? The radioactive isotope. Another very easy question. Potassium 40. Learned behavior socially acquired is called as culture. Anybody answered custom? I think it is culture, but I didn't have time to check because culture or custom? That's right. Cluster testing, where do we use? Anybody answered it as immunization? Cluster sampling is done there. Cluster testing is done in the case of contact tracing. Cluster testing for sexually transmitted infections. Cluster testing में क्या करते हैं? Give your mobile phone number, who are all the commercial sex workers you met, and how many people are involved in the middle way. Out of them, how many are politicians, how many are the seed sellers of MD. Everything you will have in the list is cluster testing fundamentally. Now most common cancer in India is oropharyngeal, undoubtedly. Now sample registration system gives a very reliable information on birth and death rate, age specific fertility, mortality, etc. This is another confusing question about the definitions, doctor. Anybody answered other than cost effective? Abba. This we discussed many times in our Sunday, doctor. That's not my mistake. We were telling definitions of that one page, input output PERT analysis, cost effective, cost benefit, small differences will be there. Examiner will catch feet on that level only. Cost benefit means the benefit is expressed as a monetary term. Kitta paisa aa gaya, kitta paisa gaya. Cost effective means the benefit, instead of being in the money, rupee mein, instead of that it is being the results achieved, like number of lives saved, etc. Then you call cost effective analysis is what you have to differentiate. What is Gobi and UNICEF? Very old question this is. Gobi, now it is called Gobi FFF. F means female education, family spacing, food supplements, growth monitoring, oral rehydration, breastfeeding and immunization is what you have to basically remember. Yes, comes our favorite question. Baba Black Sheep, where have you gone? Only question which I expected but did not come was cow's milk and breast milk. Examiner left it because all our surrounding states were asking that. So you are all very sure category 1 are human anatomical waste. Yellow bag is prepared for 1, 2, 3, 6 and we do incineration or deep burial is what you have to basically do. This is one of the old questions, doctor. I still remember 2000 May 2000 while I was about almost 12 years back, while I was preparing for MD entrance, already I got seat in MD SPM. I was crying why I joined this SPM. So I was playing with my child sitting on the top of the home reading for the entrance exam in Pondicherry while doing MD SPM with full humid environment, studying the last pages of Park, psychrometer, relative humidity, etc. I thought when will this will be over in this life. Once more the question has come after a long time. So I hope this will become the last time you read this topic because you are joining the MD at any cost. Sling psychrometer is for the relative humidity is what we need to appreciate. So primary prevention, you know very well that better living condition, improved health and welfare resources, improving social environment, preventing harmful lifestyle, etc. is basically you do in population all this jnana spirituality centers. That is what you will be doing in primary prevention. Japanese encephalitis, I think this is the easiest question. Malaria is caused by filaria or not, or by Anopheles. I mean Culex or Anopheles, that kind of a question. So you know Culex, Incus, Vishnui, they are the ones who are the vectors of the Japanese encephalitis, not the dengue virus organisms. Now margarines is famous cell carcinoma, one of the oldest questions. What is fissure in ano problem? If there is a fissure, there is a friction for the passage of stool that lead to sphincteric spasm. The spasm will further increase the friction. It's a cyclical phenomena. So any drug used to treat fissure in ano is main purpose is what? To lubricate the path and decrease the transsphincteric spasm is what we have to fundamentally appreciate. Circumferential full thickness burn, you will be doing eschorotomy. Now between bipolar and monopolar cautery, electrosurgical injuries are more common with the monopolar cautery. Monopolar means you have got this is a typical bipolar circuit and here this is a monopolar. There is in monopolar cautery there is a more diffuse spread of that electrical heat energy. So more tissues get burnt. Whereas bipolar cautery it is very localized burns which you are applying. So it is more common in the typical case of monopolar cautery. Hypospadias is a absolute contraindication for circumcision. Now dentigerous cysts and unerupted permanent tooth crown, quite a commonly known question.